everyone. I'm Doris McMillon, and welcome to Inner Health, Outer Beauty, where we shatter the myths about health and we talk about the latest and greatest in cosmetic procedures and how they can work for you. Now, today, we're going to flip the script. Normally, it's Dr. Wanda Dyson who is doing the asking, and the person sitting where I am would be answering the questions. But she's got so much great information today that I've got to ask her some very important questions. So here we go. I have a little story to tell you. In my past career, I was a news anchor and a talk show host. And I remember interviewing some doctors who worked for the U.S. Army, and they worked in the biological warfare division. And so we were having a conversation, and I said, "Hey, doc, I've got a dent right between my eyes. In fact, it was so deep, you could have dropped a quarter and you might have gotten change back." I said, "What can I do about this?" And he said, "Botox." I said, "Botox?" And he said, "Yeah, you want the dent to go away, right?" But I'm thinking, Botox, botulinum, poison. You want me to put poison in my head? So anyway, that brings me back to what we're going to be talking about today, and that is Botox. So Dr. Wanda, please tell us, what is Botox? As you can see, I'm still here, so I didn't die, right?
You're still here. And Botox has been used for cosmetic purposes since 2002, and I've been injecting it since 2004. And it's a purified protein derivative of a toxin produced by a bacteria.
So how does it work?
So what it does is it relaxes the nerve that goes to the muscle, and then your muscles smooth out. And it's usually used on your muscles of facial expression, like the muscles, they call them the 11s now for short, but the muscles between your two eyebrows, and also when you raise your forehead, you see some lines there. It's used to relax those, as well as what we call the crow's feet.
Okay, so when somebody lifts their eyebrows and they get these furrows, I call that the Shar-Pei puppy look. They look like one of those puppies that has a lot of loose skin. So the Botox will kind of tighten that up?
Yes, it would smooth it out.
Mm-hmm. And for the dent that I had between my eyes, because I think I used to squint a lot when I would speak, and I would have this dent, and even after I was through speaking, the dent was still there. So how does it take care of that?
In the same way, it relaxes the nerve that goes to the muscle, and it smooths those muscles out. Now, mind you, some people wait very long before they start their treatment, and they may end up with a crease that's hard to totally remove. So it's really good to start this treatment early. And a lot of my patients in my practice start in their 20s.
All right. Now, when this doctor told me that it was botulinum, I'm thinking poison. But is it poison? I mean, obviously I'm not dead, so how bad could it be?
It does come from the toxin from Clostridia, which is the bacteria that can cause botulism. But it is a purified derivative, so we don't have the risk of that issue, unless we get some bootleg botulinum toxin.
Which means it's very important that when you go to a medical professional, you know who they are, what their credentials are, and is this something that they do on a regular basis? Is that fair to say?
Yes, make sure they're experienced. Now, people have gotten into trouble by going to beauty salons or estheticians or people who are not even licensed physicians or nurse practitioners to get this done. So don't try to be cheap, because in the long run, it's going to cost you more money or perhaps some side effects.
Okay. How long does it last?
In general, it lasts for 3 months, but I do have some patients that last up to 6 months. So it's very individual, and we have to see based on your experience with the product. If it's your first time, I wouldn't know. So we will see after the first treatment how long it lasts in you.
How do you know how much you need? Now, I remember when I came to your office and you gave me some Botox in my forehead and between my eyes. How did you know how much I needed?
Well, I would say it's based on 18 years experience, but there are some people who are very sensitive to Botox and they need what I call like a baby Botox dose, like very, very minimal. But most times they've already been to another physician and they bring those records with them. So I just follow those previous guidelines of how much they were given. But in general, I am basing it on my experience.
Okay. What does it cost?
Well, it depends on the physician that you're seeing and how they're doing it. Some people charge per area. Some people charge per unit. Now, we don't all get the same amount of Botox. Some people get as little, in my practice, as 10 units. And there are others who get as much as 50 or even close to 100 units. Mm-hmm. So I personally charge by the unit. So you're paying for what you get. But in other practices, you may be paying by the area, irrespective of how much you're getting. So if you're getting 10 units, you're paying the same amount as someone who's getting 50 or even 100 units.
Okay. But overall, it helps delay that aging process. Is that fair to say?
I would say it helps to prevent a permanent crease there. It opens up the eyebrows and it gives them some lift. If you're getting like droopiness with the eyelids as we get older, the eyebrows are falling, it helps to lift that up. The brows in the middle area, but also laterally on the outside. We can pull that up by injecting the lateral aspect of the eyebrows as well.
All right. So how long have people been using Botox cosmetically?
It's been used cosmetically since 2002. And as I said earlier, I've been injecting it since 2004, so almost since the beginning.
Okay. Now, I'd like to shift because there's another product or procedure I'd like to talk about. And I think it can be used in tandem with the Botox. And it's what I've been hearing, they're called fillers, where they fill up empty spaces, for lack of a better description, on your face.
People get fillers and Botox confused. They don't know the difference. Mm-hmm. They do two different things. Fillers are not for wrinkles. It's not for the motion of frowning or movement of the muscles in the face. Fillers are more for filling in the volume that we lose as we age. And there are different types of fillers. There are most commonly, you've heard of hyaluronic acid fillers like Juvederm or Restylane, but there are many other types of fillers, and I inject most of them that are available on the market.
Okay, so as we get older, one of the things that I've noticed is that the area around the eyes starts to hollow out. You start to get these deep laugh lines. Again, look like you could insert a few quarters in there and, you might get some change back. But as we age, our skin starts to drop. How do the fillers plump us back up?
So you mentioned a couple of areas, and one was the hollows under the eyes. You can use fillers under the eyes to plump that area up, but I personally prefer not to use filler in that area because they have found that the fillers can track behind the eyeballs, and I don't want that. That's a complication of fillers. They can see that when they do like MRI scans or something. Mm-hmm. I prefer to use PRF gel, which is a product that comes from your own body. I draw your blood, I make a gel of it. It has growth factors in it that fill out those hollows. So that is a better option, and that can't cause any harm because it's your own body.
Okay. What about the laugh lines? What can we do about those?
The laugh lines, to me, injecting the laugh lines themselves are, that's a very novice injector.
Mm-hmm.
That really the issue is not the laugh lines. The face falls from above. It falls downward and forward. So the treatment to get the face back into place is to pull it back and upward. And that can be done in many different ways, one of which is PDO threads, but you can also fill the face back up with filler, and the temporal areas become hollow. So filling that area back up can bring the face back into place. Also, bringing back the volume. If you have very sunken cheeks, the cheeks have lost volume. The cheeks lose hyaluronic acid, they lose fat, they lose bone, and you lose collagen as well. So and muscle. So you can use what we call biostimulators, and that would be fillers such as Radiesse, which helps to restore the collagen and also the elastin of the face. You can use PRF gel, which helps to restore the bone, the fat, the muscle, and those are called biostimulators. You can also use Sculpture there, which is another biostimulator, which helps to rejuvenate those areas. I also like to fill in volume. Mm-hmm. If they've had a lot of loss in volume and they're 60, 50, 60 years old, I may use both. I may use a filler such as hyaluronic acid, and then I might also rejuvenate the face with PRF gel.
Okay. At what age are you seeing your patients coming in to get these fillers? Because the last thing I know we women and men want to do or don't want to do is we don't want to look tired and worn out and beat up. You know, we want to look refreshed. So at what age are you seeing your patients start to come in?
Well, I would say they come in mainly in their 50s and 60s. Mm-hmm. And I think they have unrealistic expectations of what can be done because they've never had anything done. Mm-hmm. And there's a rule of thumb, and that rule of thumb is that for each decade, we need 1 syringe of fillers. So if you come in at 60, that's 6 syringes. If you come in at 50, that's 5 syringes. Mm-hmm. But it doesn't always hold true because the person may respond very well and quickly to it. So they may need less than the amount, I think, based on their age, or they could need more.
Okay, and how long do the fillers last?
It depends on the fillers. We have lots of different classes of fillers, but mainly the ones that I use, Restylane Lift or Juvederm Voluma, Restylane Lift lasts about 18 months and Voluma lasts 2 years. There are also other fillers on the market, such as Bellafill, which is a collagen filler with PMMA, which stimulates your own body to produce collagen. And that one lasts about 5 years.
Okay. What's the cost involved here? I know there are folks who are watching this saying, well, what do I need to start saving for?
Well, as I said, it depends on your age. That determines the number of fillers that you need. So if you're 60 years old, that's about 6 fillers. And on average, I charge about $800 per syringe for the ones that are longer lasting. Mm-hmm. I sometimes have promotions and specials, or if a patient gets a great number of fillers, then I will give them some sort of discount.
Yeah, a lot of what we're doing as we age is we want to feel good about ourselves. We want to look good. And these fillers, the Botox, provide an opportunity for people to look as good as they can look. So what do you say to the person who's like sitting on the fence saying, oh, I don't know. What should I do? What should they do?
What I say to them when they come to my practice is the longer you wait, the more it takes. Meaning, the more fillers you need, the more money it's going to cost, the more time it's going to take to arrive at your desired result. So the longer you wait, it doesn't make it less expensive, it makes it more expensive. And your result is just going to take longer.
Okay. Now, I wanted to ask you about one other filler. I watch Access Hollywood because I like to see what the stars are doing. And some of the women I have seen, if you see pictures of them when they first started in their acting careers, they had very thin lips. Now, fast forward a few years and they're very successful. They've got more lips than you know what to do with. What are they doing?
They are probably using hyaluronic acid fillers like Juvederm. You can also use Bellaterol in the lips. But I think in Hollywood, they go a little bit too far. And my practice is located in Washington, D.C. on Capitol Hill. And we tend to be a lot more conservative here. And none of my patients want to look like that. And they all say, please don't make me look like Angelina Jolie. And I don't give them that look.
Yeah, we want to look natural.
Yes. My patients want to look like nothing was done, and they look like a younger version of themselves.
Great. Now, for those who may say, I'm not ready for Botox and I'm not ready for some of the fillers that you talked about, are there any natural alternatives to Botox and the fillers?
Yes. So what I would use as an alternative for the frown lines, we can use what are called smooth threads. And they're little tiny, how would I say? They're almost like acupuncture needles. They're very slim and very tiny, and they have a little thread in them. I leave a thread behind that stimulates collagen, and that smooths out the wrinkle, or I can put it directly into the muscle, and that makes the muscle less strong and powerful, kind of diminishes it for people that don't want Botox. And for people that aren't into getting the fillers, I use PRF gel, which I mentioned before earlier. But PRF gel comes from your own body. It is all natural. It's 100% safe. It comes from you. There are no additives. And what is involved in that is I draw your blood and I have different tubes. One I spin down at a different rate, put it in a heater. It becomes a gel. The other one I spin down at a lower rate for less time. And I mix the growth factors from the two tubes, and it makes a substance very similar to filler. And I can inject it in the hollows under your eyes, in the cheek area, in the smile lines, on the lower third of the face, and even in the lips. But not necessarily to make the lips larger, but to make the lips smoother and younger.
Okay. The name of your program is Inner Health, Outer Beauty. And, we've talked about what we can do to take care of the external, the Botox, the fillers, etc. And we're doing this because everybody wants to go to heaven. Nobody wants to die. And we certainly want to look good while we're here. So as we work at rejuvenation, looking younger, smoothing things out, what we see on the outside, how can we match that up so that we feel good on the inside too? We're feeling as good as we're looking externally.
Well, for women, after menopause, there is a decrease in the female hormone estrogen, and that causes a lot of the changes in the skin that we're seeing. It makes the skin thinner, it makes it drier, it makes the collagen in our skin decrease, and it really changes our skin quality.
We get that crepey look.
Yes.
Yeah. Okay.
So you can use, actually, there are some topical hormone creams that you can use on your face to help to restore the skin. You can also replace your hormones. I know many women are afraid to do so, but I'm very much a proponent of that, as you know.
Mm-hmm.
I've been on bioidentical hormone replacement therapy for about 18 years now, and I really believe that slows down the aging process.
Okay, so explain to us the difference between taking a hormone once you moved into menopause and using a bioidentical hormone. Would that be the
Yes.
correct terminology?
So when people think of hormone replacement and they're talking about HRT, they are talking about a synthetic hormone. It's called conjugated equine estrogen, and that is a hormone which comes from pregnant horses.
Okay.
It is metabolized into so many different metabolites that we can't measure it. And so when they studied hormones and they came up with all these problems as a result of hormone replacement therapy, that is what they were studying, conjugated equine estrogen. What I am using is bioidentical hormone replacement therapy. And that comes from either yam or soy, and it is modified to be exactly like the estrogen in our bodies. And it is very measurable.
Now, I know that we can take a pill for the HRT. How do you use the bioidentical hormone?
The bioidentical hormones can be used transdermally, and that is through the skin. And I just rub it daily, twice daily on the back of my knee, behind the knee. You can rub it in other areas like the arm or the thigh area. It can also be done intravaginally. And some people do oral progesterone. I don't completely agree with that. I think it all should be through the skin. The Danish did a study, and it was close to 700,000 women. And what they found was giving it intravaginally reduced the risk of heart attack by over 40%, and giving it through the skin reduced the risk of heart attack by 38%. And as I said, it also has the extra added benefit of slowing the aging process on the skin.
All right, so that means that you're not dealing with dry skin, which is one of the things that we see as we get older.
Thinning.
Does it take that crepiness away?
Well, it depends on when you start it. If you start it at menopause, you probably can slow all that down. But if you wait until the onset of it all, it depends on how severe it is. It may help, but it depends on, at what point you start it.
Yeah. Not long ago, I was in a grocery store, and the cashier was ringing up my groceries, and she was sweating bullets. Okay. I mean, water was literally running down her face, and it was so noticeable. I said, my dear, I just, I'm that kind of person. I just kind of asked the question. I said, are you going through menopause? She said, oh, yes, she said, and I feel terrible. I said, well, why aren't you taking something? And she just talked about, one, she wasn't sure what to take, and two, she kind of had a little trepidation. So what do you tell the woman who's suffering from night sweats or day sweats where water is literally just pouring down their faces?
Well, I mean, if they came to me, I would talk to them about bioidentical hormone replacement therapy and its benefits, and that it's not the same thing as HRT, which was studied in the Women's Health Initiative, which showed the increase in risk of breast cancer and heart disease and stroke and clots in the legs that go to the lung. We call that pulmonary embolism.
Mhm.
So we're not talking about the same thing when we're talking about HRT, which scared a lot of women off of hormone replacement, as well as physicians are afraid to prescribe it, but they also don't know the difference. For me, my menopause was so severe that I could not imagine living the rest of my life in that state.
Mhm. Yeah, and when I saw this woman, I was like, how do you cope? I mean, you work in the public, you work with the public, and you look like somebody just dumped a can of water or a bucket of water on you. And she was, I think she was glad to hear, because I mentioned her based on my relationship with you and you teaching me about these things. I mentioned it to her as well. So I think she kind of had a little some relief in learning that there was something to minimize her symptoms.
Well, some people believe they're supposed to suffer,
No.
and when I went to my OBGYN, he offered me Prozac. He did not offer me any type of hormone replacement, which I knew I didn't have a deficiency in Prozac. I knew I had a deficiency in the female hormone estrogen.
So when women go to the doctor and they are having these symptoms, educate them now and tell them what they ought to be asking, writing down some notes before they go in so they don't forget. How can they get better educated about dealing with being a woman who is aging?
Well, I would say that's pretty difficult because it depends on how open-minded
Mhm.
your doctor is. And if they're against it, then they're going to do everything to turn you against it and tell you that it's dangerous. If it's a man, he might not be empathetic.
Mhm.
If it's a woman who is like in her 30s or 40s and she hasn't gone through this, she doesn't understand it. I know that when I was in my 30s and my patients were going through menopause, I really didn't know what was going on with them. And they had some psychological complaints. I was actually referring them to a psychiatrist.
Hmm.
I didn't understand what was going on until I went through menopause, until it hit me like a ton of bricks. And I was like, oh, that's what this is.
Yeah.
And this is intolerable. I have to do something about it.
Uh-huh.
So they have to find the right practitioner.
And that means asking questions and not being afraid to say, you may not be the right practitioner for me.
Yeah, but you have to be able to think. It's a lot to sort out as well.
Mm-hmm.
It's a lot. And as far as the Women's Health Initiative and an increase in breast cancer,
Mm-hmm.
there haven't been many studies in the US about bioidentical hormone replacement therapy and if that would increase breast cancer. So all the research that I find comes from other countries like Britain or maybe Canada. And what they did say that if a woman gets breast cancer, it is more treatable because it's not as an advanced state
Mm-hmm.
as when they're not on any type of hormone replacement.
Okay. I love the fact that the name of your program is Inner Health, Outer Beauty, and you get a chance to address the things that we look at when we look in the mirror in the morning and before we go to bed at night, and then how we age. What do you say to men and women about how to age gracefully?
Well, what I have really discovered lately has been a real eye-opener. And I really didn't realize the impact of glutathione on how we age, and that can actually be replaced. Glutathione is a master antioxidant, and they have used it in women, and they have found after 3 weeks that they had fewer wrinkles, more elasticity in the skin, and less discoloration. And that seemed to persist. They also found that the inflammation in women's bodies, which they measured when they put them on a supplement to increase glutathione, the inflammation went down, and that also persisted for many months after they were off of the supplement. So anyone who's afraid of hormones for whatever reason, be it male or female, I recommend wholeheartedly a glutathione supplement that I've really recently come across, and it's called Immunical.
So how
I
does
recommend that.
How is it administered?
It is oral. It's an oral supplement.
Okay.
And so a lot of people have heard of going to get IV glutathione, and it has benefits to it. However, it's like a burst and then it goes away. So if you take it every day, you can have a sustainable glutathione level, which is markedly beneficial to many of the diseases that we see are related to low glutathione, such as high blood pressure, diabetes, heart disease, cancer, arthritis, any type of inflammatory disease. They're all related to low glutathione, not to mention how we look on the outside.
So where do you get this? Can you just walk into your pharmacy and buy a bottle of it? I mean, if you want something that's really good.
They'll be able to order it directly from my website, which is cflwellness.com. I haven't put it up on my site yet, but that will be available very soon. And I've been taking it every day myself. It has been remarkable in the results that many people have seen with it.
And is glutathione something that you can take sublingually, like underneath your tongue, or is it just a pill that you swallow?
Well, it's actually a powder that you mix with water, and it becomes sort of like foamy, and you drink it.
Okay.
And it reduces inflammation in the body. It reduces what we call antioxidant stress, which is related to aging. So it's basically either keeping you well or reversing the aging process or staving it off.
Okay, I was going to say, can we really reverse it? I mean, because every day we're getting older.
Well, we're getting older, and it's directly related to those levels. They've done studies, and they said that those illnesses that I'm talking about are actually markers of aging and markers of low glutathione.
Oh.
So COPD, asthma, cancer, dementia, multiple sclerosis, a lot of things that I didn't see as connected by that thread of low glutathione now has changed the total way that I see disease and aging.
All right. You have given us just a wealth of information just for every day, keeping yourself together. And it seems to me that now is the time, wherever you are, is to make that investment in yourself. And it should probably start there, because we want to be healthy, we want to look good, and we want to feel good. We truly want inner health and outer beauty. Dr. D, thank you so much for all of this wonderful information that you've shared with us. Is there anything else you'd like to add?
I would like to thank you for your friendship, for being my coach for over these years, and taking your time to do this for me today.
It is my pleasure. I think you are an absolutely fabulous woman, friend, professional, and it's my pleasure and privilege to be able to do this. So to all of you out there, make sure that you take a look at the Change for Life Wellness and Aesthetics website, and make sure you tune in next time for Inner Health, Outer Beauty. I'm Doris McMillon. Thanks so much for being with us.
Thanks again.